Hi, I'm Dr. Devin Garza, and I'm going to be mentioning a few things about this novel use of telemedicine, what it is, why we're trying to implement this, and how I think it's going to be beneficial to you as a patient or potential patient. As you are well aware, the COVID-19 virus pandemic has clearly affected all of us and our loved ones in some way, shape, or form. My goal is to help limit how that will affect our communication or the potential for us being able to communicate in a way that helps me to see what's going on, what you need, what your health concerns are as it applies to gynecology, pelvic pain, abnormal bleeding, infertility, all of the things that I take care of on a regular basis. What I don't want is for you not to be able to see me over the next 2 months because we are all socially isolating and things are only going to continue to get a little worse before they get better. And God willing, all the things we're putting in place are going to help really limit that to ourselves and to our loved ones. So what is telemedicine? Telemedicine is a way for us to virtually communicate over some means of communication, hopefully video conferencing, but sometimes it's going to be via telephone. And government and federal government mandates that are trying to protect us all with Health Information Protection Act has been relaxed, but we clearly want to maintain the privacy of your healthcare information and your private information. So we have implemented things in place and platforms that assure us that we're going to do our best to do that. The reason that we would do this is, of course, so that you don't have to come see me in person. The value is significant. I can still listen, we can still talk. You can give me all of the historically important aspects. You can still send in your health history to me at my office so that I can have that to review as well, much like we would do in a regular office visit. Imaging can be ordered, sometimes even prescriptions will be allowable depending on what's happening. But what I will not be able to do, in other words, the limitations here, are going to be that I can't perform a physical exam. A physical exam with regard to these gynecologic related, potentially for surgery, etc., or in non-surgical aspects, it's an important aspect of how we take care of you. Most of the time it will help me to confirm what I'm thinking is going on, as does imaging. It's not the most critical aspect for many things. For example, if I have imaging and we discuss how your symptoms are being are playing out based on your pathology, a lot of times we can come up with a very solid, reasonable options to what you have going on, and we can pick and choose that even without having a physical examination. I take care of a lot of patients from all over the country, and this is going to help you guys being taken care of in a way that can really be more efficient for your use of time. So with all that being said, it will be made very clear to you when you call my office and when you look at my website. Probably not here in the beginning, but very soon it'll be made very easy for you to understand and know how to take advantage of using telemedicine, which I think will probably be the vast majority of our visits over the next couple of months, probably through May and June. So I know there will be questions, and those are okay, but I hope this helps to alleviate some of the tension and stress regarding not being able to come in to see me, when actually we can communicate very clearly and make a very good, solid, and reasonable plan of care and educate you on the aspects of what's happening with you very soon. Thank you for your time, and I hope that you take advantage of this telemedicine opportunity.